antipsychotics can calm your mind, but can also make your body to pay for the price. Welcome to Mental Health and Science with Enoch Francis. In today's video, I'm going to teach about what we call extrapyramidal side effect, about the side effects which are caused by what we call antipsychotics or mental acid drugs. This video is good for you if you are a medical student, you are a nurse, you are a clinician, you are a doctor, and even another well-wisher. Okay, so we are going to talk about some of these. What are extrapyramidal side effects, and also we shall look at the antipsychotics, the types of antipsychotics and their side effects, and which one for us to use in which case, and which other case can we use what? This one. So extrapyramidal side effects, we would say that these are side effects which are caused by antipsychotics medicine. So we have extremes of our bodies. For example, you see my fingers. These are extremes. They are extremes of our body. You see my lips. These are extremes of my what? When you look at your feet, those are extremes of what? Of your body. So we are saying that these are side effects which are going to happen at your extremes of what? Of your body, of the limbs. Okay. So we have two types of antipsychotics. Okay, and where do we get this name? The word antipsychotics is coming from the word psychosis. Psychosis is a condition which is characterized by hallucinations, delusions, and what? Disorganized behavior. Okay, the medicine that is given to control the psychotic features is called antipsychotics. So under this we have two types of classes. There is what we call first generation antipsychotics. Sometimes it is called typical antipsychotics. Then also we are also having what we call second generation antipsychotics. Okay. So let us look at each class. Okay. Under the first generation, sometimes we call it typical antipsychotics. The name is given to them in that they have more side effects than the second what? Generation. Okay? And also they are readily available. They are readily available. They are cheap. And examples of them, we have chlorpromazine, which most people know as CPZ. We have Haldol. We also have what we call haloperidol injection, which is a monthly injection. We have what we call sterazine or triopiperazine. That is another name for what? For sterazine. Then also we have also what we call, I think I've talked about fluphenazine injection. It is a monthly injection. Some of these drugs are available in injection form. For example, we have chlorpromazine, which is available in tablet and injection form. We have haloperidol or Haldol, which is available also in injection form, and also what? Also tablets. So all these drugs, they do the same work. Okay? So when you are giving someone these antipsychotics, you just only need one type of antipsychotics. There is no need for you to give someone Haldol tablets. Again, you also give also chlorpromazine one tablet. So you have to choose which one are you giving. But you can give two antipsychotics in different forms. For example, when I can give chlorpromazine injection and also give Haldol tablets at the same what? At the same time, that one is okay. But if you give Haldol injection, you give chlorpromazine injection at the same time, what are you trying to manage? That is not allowed. Okay. So in case you have clients, for example, if they bring for you an aggressive patient, which drug is good for you? Okay. If they bring someone who's aggressive, the first thing for you to think about in your mind is to calm down the situation, is to calm down the patient. So chlorpromazine is a good drug which is good at sedative and calming down someone. So we give chlorpromazine. Then also you can add benzodiazepine, that is diazepam, which is very common. When you combine this one, they have synergistic effect. what we call the rapid tranquilization. They can calm down the patient very fast. Okay, but also this medicine is contraindicated in people with epilepsy. Don't give CPZ or chlorpromazine in patients who have who have epilepsy. Why? Because it will worsen their seizures. Okay, but in case you get someone who is having epilepsy and is aggressive, because sometimes they can bring for you an epileptic patient and is aggressive, is having psychotic features. So you can give IM haloperidol injection. It is also available. And what are the modes of the mode of action of these drugs? In the body we have what we call neurotransmitters and chemicals like hormones which control our behavior. So one of the hormones that we have to know is called dopamine. So dopamine controls our movement, it controls our behavior, it controls our motivation. Okay? So the mode of action of this is to block the dopamine receptors. Why? Because if in the body there is excess production of dopamine, it causes the psychotic features. It increases what we call hallucinations, the delusions, and the disorganized behavior. So the mode of action of this drug is to go and block the dopamine D2 receptors. That is how I can simplify it for you. So when it blocks that, then we shall be reducing those psychotic the psychotic features, the hallucination will be will be reduced. So all these drugs have the same mode of action, whether it is second generation or first generation antipsychotics. Then also we have the second generation. They also have the same side effect, but this time they are reduced side effect. They don't have very many side effects, but also you have to know that these drugs are expensive. Sometimes they are not available in our hospitals. You will not find them. For example, olanzapine, we have risperidone, we have quetiapine. They are very good drugs, but also we recommend to be given to children and the elderly, because when we give these drugs to people, the elderly, if we give them the first generation antipsychotics, they face a lot of serious side effects. Okay, so as I'm finishing this video, if I'm requesting, if you are new to this channel, please subscribe, because it motivates me to make more videos. So let us go to the side effects of antipsychotics. Okay, and also how we can manage them. One of them is even before we go up there, but this antipsychotics cause what we call movement disorders. Movement. Okay, that's the first point you have to know. So one of them is called acute dystonia. That is caused by muscle spasms. Like you can find the muscles are moving a bit, like you find them shaking, like let's say a weather, like you are reacting to a weather, or the weather is very cold. You can find the muscles shaking. That is called acute dystonia. Then we also have what we call akathisia. Akathisia is characterized by restlessness. Okay, you find a patient is unable to sit in one place, like he's moving from this corner and also going to the other corner, comes back, he cannot sit in one place. That is what we are called akathisia. It is characterized by restlessness. Okay, then also there is what we call drug-induced Parkinsonism. Remember, we have Parkinsonism, which is not due to drugs, but this one is due to antipsychotics. Okay, it is a movement disorder. So this one is there is a slow movement, like someone is moving very slowly. Okay, we also have muscle rigidity. You find the muscles are very stiff. Someone is moving as if Then also we have tremors. You can find someone shaking. Okay, that is a drug-induced Parkinsonism. Then also we have what we call tardive dyskinesia. This is also another condition which always happens when you give someone high doses of haloperidol or other typical antipsychotics. So how do we know tardive dyskinesia? You will find someone has a, I don't know whether you have ever seen a rabbit, but I want you to look at a rabbit when you go back home or anywhere. You find the movement of the lips. Okay? You find the lips of the patient, they are moving like the mouth of a rabbit. So there is what we call lip smacking or chewing mouth movements. In other words, that is a sign of what we call tardive dyskinesia. Then also we are also having tongue protrusion. You find the tongue is out. That is a side effect, and also this is under what we are calling tardive what? Dyskinesia. So then also there is another extrapyramidal side effect which you call neuroptic malignant syndrome. This is a fatal, this is an emergency. In case you give someone and reacts to the medication, please, you need to manage it very well, or it is going to lead someone to die or to kill. It's going to kill somebody. So it is characterized by hypothermia, that is high fevers, temperatures of 38 and above degrees Celsius. Okay, and also it has also muscle rigidity. So you may find muscle stiffness. Okay, then also altered mental state, like you find someone is confused. Okay, is talking things that you cannot understand. Then also there is increased heartbeat. That is what we call tachycardia. That is the signs of what we are calling neuroptic malignant what? Syndrome. The word neuroptics means antipsychotics. Okay, so when you give, this person can react and have this kind of what? Effect. So these are some of the extrapyramidal side effects that we have, but also there are others where you find someone is moving as if he's pushing a wheelbarrow, very stiff. We can have, you find the hands are moving. It can be one side. Even when the patient is moving, wherever he puts the finger is what? Is moving. Okay? We can have someone looking in one side. Those are extrapyramidal side effect of what? Of antipsychotics. Sometimes when you give these drugs, they are sedative. Okay, they make someone to sleep. Okay, sometimes they can cause dizziness, and also sometimes there is what we call like reduced sexual urge. Like if you give someone, a man, you may find that he may fail to perform his work as a man, or to have that libido will be taken away. He doesn't have the sexual desire. Okay, then also they can also you find some people, they have increased appetite and also weight gain. Okay, someone is eating a lot, you find someone gaining what? A lot of weight. So if you are still new to this channel, I also request you to subscribe, like, comment, because this one motivates me to make videos which are of this nature. So as we are concluding, how can we manage extrapyramidal side effect? Okay, so if you're a student, you're a nurse, you're a health worker who is out there, I am saying that whenever you prescribe an antipsychotic medicine, there must be another medicine to control the side effects. These drugs, we call them, there is what we call benzixo. Okay, it is given whenever the person has the side effect. If you don't have benzixo, another name for benzixo is called Aten. You have to prescribe that. Aten is available in 2 milligrams. Another one is available in 5 milligrams. So if it is 5 milligrams, you can just give 2.5. Someone with you can give 2 milligrams, which also works, or someone can swallow the 5 milligrams. Whenever they see the side effect, they can swallow, but not something which you have to swallow every day. So these side effects can be controlled, but when you don't manage them early, they can become what? Permanent. So let us take note of that. Okay, let us avoid giving high doses of antipsychotics. only 100 milligrams of chlorpromazine can control the side effect, can manage the psychotic features. Okay, so we have injection format, we have long-acting injection, so let us use them the right way. And I'm saying that don't prescribe two antipsychotics in the same form at the same time. For example, haloperidol tablets at the same time, chlorpromazine what? Tablets. But it's acceptable to give chlorpromazine injection and also give haloperidol tablet. That one is accepted. It is accepted for you to give a long-acting medication. For example, for phenadine injection, you give chlorpromazine tablets at the same time. Okay? So thank you so much for watching my video. Let me know in the comment section some of the extrapyramidal side effects that you have seen in patients, and even you can give us the honest feedback about our video. How is the teaching? What have you learned? It will be such interesting to hear from you. So see you in my next video. Thank you so much.